Good evening and welcome to Doctors on Call. I'm Dr. Ray Christensen from the Department of Family Medicine and Biobehavioral Health at the University of Minnesota Medical School on the Duluth Regional Campus. And I'm your host tonight for a program on allergies, skin problems, and our panelists this evening will include Dr. Kristi Monson, an allergy and immunology specialist with St. Luke's Allergy and Immunology Associates, Dr. Emily Onello, a family medicine physician and faculty member at the University of Minnesota Medical School Duluth campus, and Dr. Hilary Reich, a dermatologist with Essentia Health here in Duluth. Our medical students answering the phones tonight are Eli Germel of Mapleton, Colin Graydon of Little Falls, Minnesota, and Rachel Hewer of Lester Prairie, Minnesota. The success of tonight's program is very dependent on you, the viewer. Please call in your questions on allergies and the diagnosis and treatment of skin issues like acne, eczema, skin cancer, psoriasis. The telephone numbers for your questions can be found at the bottom of your screen. So now on to tonight's program. Well, welcome and thank you all for coming this evening.
Yes, thank you.
It's always a difficult decision how to start a program, but we're right in the middle of winter, and it's really cold and it's dry. And as a physician, my hands turn to leather, so I think maybe we should talk about dry skin and hands. And Emily, what kind of things are we looking at this time of year?
Sure, I agree with you very much. It's dry skin is something we see a lot of, and particularly as we age, sometimes we lose even more oils in our skin, so it becomes more of a challenge. I think typical things are itchiness of the skin, flaking, peeling, often some deeper cracking around the nails can be difficult. And so we make some general recommendations, especially in the winter, to avoid prolonged hot showers, a lot of heat that might strip the oils from the skin, and to use some hypoallergenic, usually fragrance-free moisturizers liberally after you bathe.
Other thoughts? How about the cracks around the fingers? I'm an old crazy glue guy. Is that good or bad?
It's not necessarily bad, especially if it provides a little bit of protection. When the humidity is so low, we actually have increased water loss across the barrier of our skin, and that makes the skin more susceptible to those cracks and fissures. What I really recommend is that every time you get your hands wet, you pat dry and put some sort of moisturizer on. And I know that seems excessive that you might do that every time, but in reality in the winter, sometimes that's what you have to do just to keep up.
Well, even Perel is very drying. It's
Very.
alcohol. Mm-hmm. Kristi, do you have other thoughts on this? How often should we shower? Because that dries people out too.
Well, I think a shower every day is okay as long as you don't stay in there too long. That you're not overusing soap, you're only using cleanser on the dirty areas. That's what I tell our kids with eczema. And when you get out, pat dry, don't rub, and put a moisturizer on right away. And something greasy.
Mm-hmm.
I used to, in the days of old, suggest that maybe even Wesson oil wasn't so bad and it was inexpensive and so on. I don't know if you agree with that or not, but that was the days of old. I'm old.
I was taught that Crisco works very well, and it does.
Yeah. What's rosacea? Kristi? Oh, no, go ahead.
I'll defer to Dr. Reich.
I'm mixing you, yeah.
It's okay. Rosacea is an inflammatory condition that we see primarily on the skin of the face, usually a central face and the cheeks. It affects the hair follicles and the area around the hair follicles. Sometimes it can be an inflammatory reaction to a normal mite found on people's skin. It's sort of like acne for adults beyond those teenage acne years.
What kind of over-the-counter treatments are there? Kristi, you got any thoughts on that one?
For rosacea?
Yes.
I'll defer to Dr. Reich on that one.
That's her thing, okay.
Yeah. So as far as over-the-counter treatments for acne, there are a couple washes.
And acne and rosacea are very
similar. Acne and rosacea, right. So they're very similar. In acne, like that we think of teenage acne, blackheads, pimples, often there's an overproduction of oil, and so many of the over-the-counter washes that we use that contain salicylic acid and benzoyl peroxide lower the amount of oil. In rosacea, the skin actually can be a little bit more sensitive, and using some of those drying products can be difficult. but there are some sulfur-containing washes that can be very helpful for the treatment of rosacea. And part of it is because they calm down that inflammation. They also help to reduce the number of some of those Demodex mites that can live in your skin and cause your rosacea to flare.
Very good. Learned.
Yes.
Kristi, one of the questions that came in is cold-induced urticaria. What's urticaria?
Urticaria is hives. Urticaria is just the fancy word for hives. And so hives are blotches. They are pink, itchy, usually raised, and can be triggered by a number of things, but one of them certainly is cold. And so it's kind of an unfortunate area to live in if you have cold-induced urticaria. But a lot of times people notice, and it's usually the change in temperature. If you go from warm to cold, and then you'll notice, and then it's actually those changes in temperature when you're gonna see that flare up. Generally treated with antihistamines. The one thing that's potentially dangerous about cold-induced urticaria is that if you have a sudden cold water immersion, such as falling into a cold lake, you could potentially have anaphylaxis, which is a very severe allergic reaction. So you do need to be really careful about that.
Emily, what's anaphylaxis?
Well, I think it's great that you brought that up because I think a lot of people get those things confused sometimes. But anaphylaxis is a complex, generalized reaction within the body where there is a release, kind of a chain reaction, if you will, of various chemicals that trigger physiologic responses that can result in death, but mostly a large opening up, if you will, relaxation of blood vessels that leads to a dangerous drop in blood pressure with a simultaneous, sometimes, but in many cases, constriction of the breathing tubes. So you've sort of got all bad things happening very rapidly, very quickly, closing of the airways and dropping of the ability to maintain your blood pressure. So the idea that was just mentioned by Dr. Monson about getting immersed rapidly may be something in these particular individuals that could trigger a life-threatening response. And we see anaphylaxis from other things too, the bee sting and the penicillin shot. So it can be triggered by a variety of things, but it's a systemic response that you don't want to have.
So is there, any of you got ideas of how to get around $600 for the EpiPen? Because people like this should probably have some coverage, shouldn't they?
They should.
Right.
There
So-
are generic versions of the EpiPen, so which are a little bit less expensive, but probably still too costly, more costly than they should be.
Yeah, for your viewers who may not know, the epinephrine pen is sort of this auto-inject device, and my take on it is you're paying primarily for the device because I understand the epinephrine, the drug in there itself, is quite inexpensive. So the get around it is if you have a nurse in the family or you have someone that knows how to draw medicine up in a vial very quickly, that would be an option. They would require a fairly significant training, but otherwise, the generic, as Dr. Monson said, or just save up your pennies for something that might save your life.
So this is probably not a good question, but I'll do it anyway.
Okay.
Primatene is epinephrine.
Yes.
So could that be something someone could have along?
I think it's
That
something.
missed?
I think you could use it in that situation. Yes.
I don't know of any studies, and
I don't either. And is it guaranteed to save your life? No, but it's epinephrine. And if you're having respiratory problems or respiratory closing or wheezing because of an allergic reaction, I would use it.
Sounds like a project for you too.
I didn't even know that's what Primatene was, so.
It is.
well, it just came back over the counter.
It was
too.
re-released.
Oh.
Yeah.
Yeah.
So
And normally we
and it's
advocate.
fast absorption.
It is, and we, as allergists, generally advocate against it for use of asthma, but you bring up an interesting point.
So I've got to share some allergy questions, Rachel. Is there a hypoallergenic dog? Is there such a thing? And this person wants to know if you can debunk the myth behind if there is such a thing.
This is not my area of
And I've never heard of it,
expertise,
so.
but my understanding is no. Is that
No,
correct?
There's not, unfortunately. The allergen that you're allergic to from animals is not just in their fur or coat, it comes out in their urine and their saliva, and everything that comes out of the animal contains allergen. And so there are no truly hypoallergenic cats or dogs. There may be non-shedding dogs that maybe give off less allergen, but no true hypoallergenic dog.
Even the hairless cat.
True. That's correct.
So anybody can have this one. Are saunas bad for the skin?
I don't ever tell people that saunas are bad for the skin. In fact, I don't think that they are. I don't know that we've ever really truly studied that. What's bad for the skin is allowing for that water loss and drying out. When you're in a sauna, it's a very humid environment. So my recommendations to my patients who like to take a sauna is step out, pat dry, and apply your moisturizer.
I think I've heard that they're good. That's what I've pretty much heard. This probably comes back to you, Kristi. This is from a farmer from up in the Cromwell area. Can hay dust cause allergies?
Yes, absolutely. Hay dust, the mold in hay is actually a big allergen too. So yes, farmers can definitely get allergies and asthma from hay.
This one kind of gets more into, I'll ask the question, maybe we don't have an answer. Is there a treatment for xanthelasma? Okay, go for it.
The treatment for xanthelasma is excision, removing it.
You do that?
I do that. I can't promise it won't come back. It's not bad or dangerous, but I can get it off.
And they're usually by the eye or?
Correct. So xanthelasma are little yellow cholesterol deposits, generally occurring on the upper and lower eyelids toward the center of the face. They're benign. They're not an indication that your cholesterol levels are too high. Sometimes I see them run in families, but yes, they can easily be removed. It's a cosmetic procedure generally, and so unfortunately you have to pay for it, but yes, they can be removed.
As long as we're by the eye, this person from over across the St. Louis, I have crusty swelling red eyelids. What causes this and what can I do for this? Emily, you're the family doctor.
Well,
you want to jump on that one?
I will jump with maybe some auxiliary help here, but I agree that's something fairly common. Without knowing more of a history, I think those symptoms are very common, but there can be a variety of triggers. So I would want to know more from this person. Perhaps it could be related to some cosmetic they're applying. There are some skin conditions that can cause kind of a flaky redness around the eye. So I guess in the absence of knowing the whole history, I think people will see these the episodes of these and often can be treated with certain topical medications.
You're not going to jump in?
I think she did a great job.
So the other one that I've been told way back, I'm really getting old here, but baby shampoo. Johnson's baby shampoo, and then scrub the lids off. And that baby shampoo apparently doesn't irritate the eye.
Well, too, I would want to even discern if it's really a skin condition or sometimes really right at the base of the eyelashes. There can be, I believe it's called blepharitis. And so to discern it, it's almost worth a visit to
I think they need to go in.
Clinician to take a look and make sure we're treating the right thing.
I agree.
So we've got really good questions. Thank you very much for calling them in. What causes skin tags and what can you do to get rid of them? Whoever wants to step forward on that one.
Well, I think that's some super common thing too, and I'm not sure I know what causes them. There's actually been some interest in looking at association with metabolic conditions. But generally, I tend to see them where skin has some friction in the neckline, kind of the necklace line, the seatbelt line, sometimes in the groin area. So there are some treatments. Ignoring them is always one. Having them removed is a fairly easy office procedure. And do they come back? Maybe, or do you form another one next door where the old one was? It's hard to know. But it's pretty easy to remove them if they're irritating or bothering.
Kristi, Raynaud's fall into your area?
Not particularly.
Well, the question is what causes it, and I'm just wondering if it really falls in our expertise tonight.
Yeah.
So Raynaud's is often followed by dermatologists, especially those who really follow a lot of medical dermatology. What causes Raynaud's syndrome or Raynaud's phenomenon, I don't think that I have an answer to.
Maybe you could explain what it is.
Sure. So Raynaud's is when your hands in particular, although other areas of the body can be affected as well, will go through this cycle of a red hot finger followed by a white cold finger followed by a purple finger, and it goes through those three changes, and we think that it's from a dysregulation in the circulation in that particular digit or other body part.
Phone call from Sandstone. Does that probably comes to you, Kristi. Does the humidifier help my daughter with asthma in the morning? Doesn't say whether it does or doesn't, but
Could it?
could it?
I think if your house is very dry, it could potentially help. But I would be cautious because you don't want too much humidity, because dust mites thrive in a humid environment, and also humidifiers can get moldy. So those are things that I would be watchful for.
It's interesting.
Yeah.
Pink eye, because the question's here. Can it be transferred from animals to people?
Oh, what an interesting question. We need a veterinarian on the panel. I'm going to say I don't wholeheartedly know. I know that it can be transmitted from one eye to the other and to another human individual. I guess it would depend on the infection, on the cause of the infection. And of course, sometimes pink eye may not be infectious. It may be due to other things in the eye or the environment, maybe allergic.
Allergy.
Or even sometimes people can, in uncommon cases, mistake pink eye for something more serious, like a scleritis or a deeper inflammatory condition of the eye. So I think your caller or the person who called in is probably referring to contagious pink eye, and I'm sorry, that was a long-winded way of saying I don't know about animals anyway. Do you?
I don't know.
Yeah.
I have a question from a health professional. We talked about the dry skin, and one of the thoughts that she wanted us to talk about a little bit more is being a little more holistic about skin irritation and treating it from the inside with fluids and hydration and so on, and vitamins maybe, and other thoughts. And what would you use for hydration? I guess that's the other question that she raises.
So taking in additional fluid can help to hydrate all of your body, including your skin. However, it does not do anything to change the reality of the dry environment in which you live. And so it may help to improve your skin a little bit to take in a little bit of extra water. It may help your skin a little bit to make sure that you're eating sources of good fats and omega-3s. However, that will not change a person's tendency towards dry skin, particularly during a long Minnesota winter.
That's great.
Are there any snow molds that can cause allergies?
Well, there are a lot of molds that can cause allergy. There's nothing really that's specifically identified as a snow mold. But I think most people are referring to the mold that you find on the ground when the snow melts. And there's lots of molds out there at that time, and in the fall when in the leaves and stuff that are on the ground. And yes, they can absolutely cause allergies and asthma.
What causes psoriasis?
Psoriasis is a dysregulation in the immune system in a person's skin, not necessarily systemically, but certainly in their skin, where the immune system is actually upregulated and actually sort of attacking a person's own skin, not in the way we think about an autoimmune disease, but more of an auto-inflammatory process.
This is a question about rats and animals. Are there any allergies associated with, this was in a school that they'd found some, are there any allergies associated with the rats or with pesticides that might be used, or other ways of getting rid of the rats? I don't know if pesticides would be the right answer there, but.
Right. There's definitely been allergy associated with droppings from rodents, you know, like from mouse infestations and things like. And so that has definitely been shown to cause asthma, especially like in inner city populations where there's a lot of mice. So I think it's the same for rats, and plus the dander that they shed too.
Rachel, you do a lot of work with skin cancer. The question here is, can you get skin cancer internally?
You can have skin cancer that does what's called metastasis, which is when a piece of the tumor can break off and go deeper into the body, go into the lymph nodes, brain, bones, etc. With the most common types of skin cancer, basal and squamous cell carcinoma, that's very rare. With melanoma, which is the more dangerous and concerning kind of skin cancer, that does happen more commonly.
Emily, what do you look for when you're looking at skin when making decisions? What is melanoma like? What concerns you?
I think there's been a lot of interest in that, and some public awareness campaigns, particularly in fair-skinned individuals. What I would look at, and hopefully when the audience members go to their physician to have a physical exam, they're getting a good skin exam as well. I would look for a new lesion that has, or a changed lesion that, and by lesion, I guess I mean spot on the skin, that is usually fairly darkly pigmented. And this can get confusing because we can develop pigmented lesions as we get older. I would look for the size, what we call the border. So is it a nice circle or oval, or is it irregular? Does it have finger-like projections? Obviously the darker color. And then other things that would be concerning to me would be, is it now starting to scab or bleed? Is it oozing, becoming more mounded up or flaking? I think so. The main things would be pigmentation, size, a new lesion, or an old mole that suddenly looks really different from how it used to look.
Rachel, from a dermatologic standpoint, do you deal with lymphedema, or is there someone who is there a specialist that deals with lymphedema?
I do not deal with lymphedema. There are some dermatologists who have an interest in that particular area of medicine, but it's quite rare. I think that it's more of a subspecialty of vascular surgery, is my understanding. It's a very challenging condition to treat.
And I think physical therapy has been jumping into that arena a little bit also. This is a question about kids. What can I do for my kids when they're struggling with sleeping at night from allergies? Kristi, maybe it falls your way.
Well, you know, there's a lot of good allergy medicines over the counter now, so it's pretty easy to find something. There's nasal sprays. Like we talked about earlier, if it's too dry, maybe increasing the humidity. Those are the things. And finding out what they're allergic to so that you can actually avoid it or treat it directly. If they're having trouble sleeping, especially kids, then I really worry that they're not getting a great day at school the next day either. And then the parents are also up. So if that's affecting the quality of your kid's life, you should see an allergist.
Do environmental allergies cause asthma? And there's a lot of discussion lately about being exposed to things as a child that help stave off disease later. Is comments on that?
Well, it is interesting. I think the biggest debate is always, is it helpful to grow up with pets in the house, or is it bad for allergies? And it goes either way, but they showed that kids who grow up around a lot of animals generally do better.
How can you tell between eczema and food allergy? Easy answer to that one?
Food allergies can aggravate eczema, but they're not the sole cause of eczema.
Emily, why does my nose run when I go outside, and what can I do about it? And when I eat. I'm old.
Yes, okay, I believe the name for that is vasomotor rhinitis. Kind of triggered, my colleagues here could probably explain the whole mechanism, but I truthfully am not aware of a need to treat that besides a good soft handkerchief. I don't know. Is there more?
No, there are nerve endings in the nose, and those get stimulated, and that's what causes the runny nose. If it's really, really bothersome, there are some special nasal sprays that you can use as needed.
Well, thank you very much. It's been a great show. We have a lot of questions. I want to thank our panelists tonight, Dr. Kristi Monson, Dr. Emily Onello, and Dr. Hilary Reich, and our medical student phone volunteers, Emily Germo, Colin Graydon, and Rachel Hewer. Please join Dr. Dustin Lucarelli, on a program on lower GI problems when his panelists will be Dr. Daniel McKee, Dr. Ian Rage, and Dr. Jofas Skaya. Thank you so much for watching. Have a great night.